Hi, my name is Beth Bolden. I'm going to demonstrate how to do oral care on unconscious patients. And first of all, I'll go through my patient's MA, and I've already gone through my patient MA, and I've seen how my patient is. My patient is unconscious. He cannot assist me with anything. So the next thing I'm going to do, I'm going to proceed into my patient's room. I'll go to my patient's room, and I introduce myself, and also I'll have to identify the patient. Yes, my patient is Dojo. Yeah. So after that, I'll explain as even if my patient is unconscious, I have to explain to him what I'm going to do. So, Mr. John, I'm here to do your oral care. And after that, I'd already gathered my supplies. Since he's unconscious, he cannot help me. I have the emesis bucket. I have the toothbrush, toothpaste. I have the tongue presser, and I have several swabs that will help me soak the water once I'm done brushing his teeth. So the next thing I'm going to do, I'll perform hand hygiene. After performing, I'll provide privacy, sorry, and then I'll perform hand hygiene. And then after performing hand hygiene, I'll put on some gloves. And then I'll make sure the bed is in a position that I can work on, not lower, but in a position that I'm not straining while working on him. Once I'm done with that, since he's unconscious, I'll take a towel and I'll place it under his head so that I don't get him wet. After placing it under his head, I'm gonna help him turn towards my side. So he's turning towards my side. So the next thing I'm gonna do, I'm gonna take a toothbrush and wet the toothbrush and the tongue expressor. So I'll go inside his mouth and I'll wet his teeth since he sleeps with his mouth open. His mouth is very dry and his teeth is very dry. After I've moistened that, I'll come back and I'll put toothpaste, and still with my tongue expressor and the toothbrush, I'll go in now and start brushing his teeth, the molars, the upper molars and the premolars and the front teeth, the back teeth, and I'll also have to make sure that I brush his tongue, and I'll also brush his tongue. So when I'm done with that, I'm gonna take a syringe with some water, put in like a 20 cc or a 10 cc. I'm gonna use that with some swabs. So I'll go in and rinse his mouth as I use a swab to take off the water, and if need be I can use a suction machine. So I'll do that. I'll swab his mouth, and once I'm done brushing his teeth, I've already dried his mouth. So before I turn him on his side, I'm gonna use the towel to clean around his mouth, make sure his mouth is clean, that in the trash, and then I'll help him back to position, lift the bed of the head a little bit high. And now I've already done my oral care. I'll take off my gloves and then I'll perform hand hygiene, and I'll make sure that Mr. John is in a safe position. Thank you.